Good morning, good evening, good afternoon, wherever you are in the world. So excited to be here. Amy Cunningham again with World Eating Disorders Action Day. I'm very, very thrilled to introduce Mr. Mark Ferdinand. He's been volunteering with NEED, which is an advocacy organization he'll tell us a bit more about in Canada. And he's been doing that since 2013. He's a governance and public policy specialist. And he's very passionate about health policy and helping people and organizations address gaps in care and support across Canada. Mark has worked with NEED and 3 other eating disorders organizations, NEDIC, EDAC, and EDFC, and you can spell those out for us, Mark. And he co-developed the Canadian Eating Disorders Strategy, which was launched last year. This is, to my knowledge, is the first ever national strategy, and I think all of our countries are looking to you all for continued leadership around trying to get this done, this sort of thing done. So I'm going to pause there and welcome you, Mark.
Well, thank you very much, Amy. I'm happy to be here and to celebrate World Eating Disorder Action Day. There's many things that we can certainly do as a community and globally based on all the great work that we take inspiration from as well, from different parts of the world.
And can you tell me, Mark, what's the situation right now in terms of eating disorders prevalence and eating disorders treatment and access in Canada, and also a little more about NEED itself?
Yeah, so maybe I'll start with the last question. So NEED, we were founded, in 2012 by some really great women, Wendy Preskow, Lynn Koss, and Patty Perry, who looked around and were seeing great difficulties in eating disorders care in the country. Wendy, in particular, her and her husband have a daughter who is affected by eating disorders very directly. And so there was certainly a personal reason for NEED being established at that time to really increase awareness and also knowledge about eating disorders in Canada. So that was really the real reason it was founded. Since 2012, NEED has been putting together some public symposia and educational workshops so that people could learn more about eating disorders, how it affects people, and how we could actually help each other to do things a little bit differently. And I'll get to that in a moment. Since 2012, after about 70 educational symposia, we realized that focusing just on awareness raising wasn't enough. We had some great successes in speaking with people about what could be done and teaching people how to do it. And so just a couple of years ago, we renewed our educational focus. We've decided to really look ahead and ask ourselves, how can we actually help people do the things that we know they can do better, whether it was caring for people, providing support, or connecting with resources. And so we've just decided recently in the last 2 years to really reinvigorate our educational mandate and really focus not just on awareness building, but on formal education.
That's great. And I think that I know, working across 50 countries and having a peek into each one of them, that you all have done something that is a really great model. And I'd love to hear a little bit more about the Canadian Eating Disorder Strategy. How do you think it can be a model for other countries as they implement or begin to start looking at policies addressing eating disorders?
Yeah, so one of the biggest challenges that we had in 2016 when we decided to do a survey of different stakeholders across the country is that we didn't know a lot. And so when you ask the question, what's the state of eating disorders today? I mean, this was a fundamental question we asked ourselves and others in the eating disorders community in Canada about 5 years ago before we actually did the survey. And we didn't have a lot of good recent data just on prevalence rates for any eating disorder. We had a number of good, descriptive documents from, the Public Health Agency of Canada. A consultant who was doing some international research from Australia had come and done a study tour of Canada. And so they were able to collect some information about, what the state of eating disorders, was in Canada. but we didn't have a really solid view on the gaps in care, how many people are affected, all the great things we'd want to know when trying to design better programs and better services for people. So in 2016, when we did this survey, we sent it out to about 500 different organizations and stakeholders across the country, and we received 400 responses. And you can already tell the response rate, 80%, we were thrilled.
That's great.
We wanted to know what gaps people were experiencing in care. And when I say people who are at risk, people who are directly living with or recovering from an eating disorder, caregivers, professionals, social service providers. We wanted to know from all of these different people what the state of their lives were like in terms of addressing an eating disorder, if they're a provider or a caregiver, or a person with lived experience in trying to support their own recovery. Following from that survey in 2016, our colleagues brought together a number of people across some of those organizations that you mentioned earlier, the Eating Disorders Association of Canada, the Eating Disorders Foundation of Canada, and the National Eating Disorder Information Center. Brought together these three other organizations with NEED and listened to a group of about 70 people at a national conference and said, okay, now we know what the gaps are. What can we do to fill them? How can we make things better? And from that meeting, we were able to establish with these 70 different stakeholders, 6 different areas that needed help. Prevention. I'll explain them in a few moments. Prevention, caregiver support, treatment, education, research, and training. We were able to identify by analyzing those gaps a lot of different things that weren't working as well as we thought they should. So in the area of prevention, for example, lots of people like to try out, of course, different approaches to preventing the onset of any illness or disease. But the reality is we don't have a lot of good research on what works in what setting with which particular subpopulation or population. So thinking about school-age children, let alone older adults, there's very little research in that space of prevention. So when we were tackling this area and really getting great advice from some great experts in the area of prevention, health promotion, and in eating disorders, we knew that this was a big gap, and we had to start to identify at the very least the types of questions we would need to ask and the people we need to work with. Gatekeepers in schools, teachers, fitness professionals, dietitians, nutritionists, dentists, because apparently dentists are able to see early signs of potential problems of disordered eating.
Yes, very true.
So there are lots of different people, as you can see, involved in that one pillar alone of prevention. How can we prevent people from developing a full-blown eating disorder, in other words, diagnosable? And what can we do to help lessen the impacts of any triggers that might cause people to become more disordered in their eating? So training, we all know the story of training. Many medical professionals we hear here in Canada receive less than a couple of hours, maybe 3 to 4 hours. I'll be generous, 5 hours.
If 3 to 4 or 5 you're getting, that's twice what most countries are getting.
Yes, in their whole entire professional education at university level, it is only a few hours of training or exposure to eating disorders. So we know that there's a huge gap. We've heard from professionals themselves, they don't have the knowledge to appropriately assess or diagnose. And that's, we understand there are primary care providers who have to be generalists, have to know a little bit about everything, and they might feel like, okay, but there's an eating disorder specialist. There's someone to whom I can turn to refer someone if they need care or treatment. But even eating disorder specialists may not have all of the knowledge that they need in order to appropriately assess, treat, diagnose an eating disorder, let alone help parents and caregivers or people with, in recovery, deal with all of the challenges and setbacks we know they might experience when they're outside of a care setting. So training is a big area where we know we can leverage the some 80,000 doctors we have in Canada. We can find ways to provide them with resources to increase their knowledge. But the other
Wonderful.
problem we hear is people don't have confidence,
Hmm.
and they don't have skills. And I think that's the area that we're focused on through this eating disorder strategy, is saying, how can NEED help practitioners and providers develop the skills they need to do three key core things? How can they better communicate with people who are at risk and people affected by eating disorders and their caregivers? How can they communicate better with the larger team of care that we know is required in order to support recovery from eating disorders? How can we help them develop the collaboration skills that are needed in order to help someone who may not want to be
Mm-hmm.
talking to a doctor, as we know, may
Sure.
not feel like they can trust a primary care provider in the first place? So in other words, how can that provider or
Mm-hmm.
professional or even caregiver or family member use better collaboration skills to help increase a person's motivation,
Mm-hmm.
so that they feel like, A, I can trust you, B, you're talking to me in a way that feels empathic,
Mm-hmm.
caring, like you really care about my progress and my own agency in helping myself.
Mm-hmm.
There's a lot of skills that are caught up in there that, again, are certainly not taught during professional education, but we would also say could also be something that people could learn in family settings as well. So that
Wow.
training and education part of the strategy is NEED's core focus. We believe that it's not enough to give people an indication as to what they need to do. So
Mm-hmm.
knowledge is great. It's a great foundation. We need to help people figure out, how
How to
can
do
I
it.
do this better? How can I communicate better? How can I collaborate better? And how can I connect better with resources that are around me or that are available virtually in Australia, in New Zealand, in the
Mm-hmm.
UK, in the United States, or in other provinces in Canada, because we know that the resources exist, but people may not know how to navigate and find them.
Well,
So we're all,
you've done such a lot of work in the last few years, Mark, and I've seen the profile of eating disorders be raised so much in Canada.
mhm.
I've noted I can see the difference in different countries, and Canada has really taken off. And I wondered if you might want to say some things about what I mentioned at the beginning of the call before we turned the mic on,
Mhm.
that, and I'm living in the US now after being overseas in East Africa for the last 20 something years. And COVID is obviously just hitting us hard and is
Mm.
really, really stressful, and certainly has impacts on people living with eating disorders or in recovery, and family members being caught in the house and, maybe struggling with trying to get access to basic needs. And then also the injustice issues that we're seeing around the
Mhm.
killing of George Floyd the other day, the death of George Floyd. And that's been really weighing heavy, I think, on all of us as activists. And it's sort of brought to the forefront injustice in general, and injustice according to race issues, injustice according to being treated well by the police, injustice for people of color and indigenous populations in accessing mental health and eating disorders care. How do you think we can use this horrible situation as some kind of opportunity to affect change in the mental health and eating disorders field?
That's a great question. I would actually step back and say we're actually thankfully already probably addressing some of the great gaps and injustices that have existed for eating disorders in particular a number of years.
Mm-hmm.
Um, 2 years ago, the Canadian Institute for Health Information did a survey, which I thought was awesome, because one of the biggest gaps that we have in eating disorders in Canada is a lack of data, a lack of measurement.
Yep.
Um, Mental health and mental illness, as you know, remains the orphan of healthcare in many countries around the world. And one of the biggest gaps, and this is for me a big injustice, is our inability, it seems, as a country to get behind measuring appropriately. If
Mm-hmm.
we only measured things appropriately, we might get a better sense and a better view as to how these disorders are affecting different populations.
Mm-hmm.
Now, so I kind of, want to give kudos certainly to the Canadian Institute for Health Information, because they did this survey in 2018. NEED was invited to their offices to actually talk a little bit about some of the gaps in mental illness data and why it needed to expand beyond biomedical measures. As we know, in eating disorders, we could look at, BMI and maybe weight and blood pressure and heartbeats per minute. And that will only tell part of the story as it relates to how you can help encourage, recovery.
Right.
And so I kind of look back and say, there is a little bit of progress, thankfully, that has been made in filling really a big gap. How can we use the injustice that we are experiencing, the injustices that are being experienced in today's society? I think that, COVID-19, if I kind of, look at COVID-19 and the pandemic in particular, I think a lot of people now have a better appreciation as what it means to have their lives really restricted in important ways, and their ability to even earn an income. It is probably 1,000 times worse for people suffering from a mental illness, where they don't have necessarily the same level of control in all cases of the symptoms when they occur, how they affect themselves, and the same for people who are certainly living with them. So I think people have maybe a better appreciation of what it means to have parts of their lives put on hold today than maybe they did in the past. I don't want to minimize people's experiences with eating disorders or mental illness, but I think, this at least provides an opening for a dialogue as to what it might be like to now live with a condition that you don't have control over. As you know, eating disorders are a serious psychiatric illness, and people, we've had, heard people having to address stigma around, really silly comments from some primary care providers.
Absolutely.
All you need to do is eat. Well,
try saying that to someone who,
not as simple
mother
as that.
or a parent feeding someone who's anorexic.
Absolutely. Not as simple as that. And so I think, in that sense, we can use, these times of at least reflection. I think when people are reflecting on their lives, reflecting on injustice as well. And injustice is, whether or not society is doing everything it can to understand another person's experience. I think that's what these different situations, afford us, is the ability to step back and ask ourselves, do I truly and really understand how this other person or this other community or these other people who are dealing with something that I have no insight into, do we really understand how they're dealing with that? Or do we even understand what society is doing? Do we have enough programs or services that are near people in order for them to at least start that process of recovery, or start that dialogue with their caregiver, provider, family member in a way that is more respectful, more empathic, kinder? I think in the end, right, if we take any of the issues that you've raised, we have to ask ourselves, are we being kind enough when we're providing either support, social services, or care, or designing programs, or allocating scarce resources, or funding? These are maybe some of the things that come to mind when I think about some of the injustices that are being experienced in today's society.
Mark, thank you so much for that. And I'm afraid we're out of time, and we really want to get this up on the web right away.
Yes, yeah.
Yes, really thrilled that you could speak with us. Again, folks, this is Mark, oopsie, my thing, from a national initiative for eating disorders. And we're really excited to have you here. Could you leave folks with any parting words around why World Eating Disorders Action Day is important?
Well, I think as everyone in the eating disorder community or people who are touched by eating disorders know, action on eating disorders is every day. It's not just on June 2nd. And I think one of the things that we can take inspiration in is knowing that this 4th annual Action Day is something that we can use as a springboard to really do.
Fifth.
Oh, 5th?
Yes.
There you go. The 5th annual. It seems like yesterday.
It does.
the 5th annual Action Day to really think about how can I help change someone's life, whether it's a colleague or a person I'm caring for. Those little actions make such a big difference. How can I help my primary care provider be a little bit more patient, kinder, more conscious of the words that they use when they speak to someone? How can I help talk to a policymaker who may not know everything about funding levels and how dismal they are in eating disorders around the world, not just here in Canada, but also in areas of mental illness?
Right.
Any action that we take can make a difference. And I would encourage everyone to think about the small actions they can take to really change someone else's life, at the very least in terms of their awareness, or some of the actions they can take in order to improve outcomes related to eating disorders.
Thank you so much, Mark Ferdinand. You're awesome. Canada's doing a great job, and we look forward to seeing everybody out on social media. Lots of things happening in Canada and around the world tomorrow. And well, by the time this is shown, it might be today. But
Yes.
Really, really looking forward to seeing you all. And it was so great to talk to you in person, Mark.
Very good to meet you, Amy. Thank you very much.